For the shoulder pains, the first thing first is you probably would like to inspect from the front. You would like to see the contours of the shoulder joint. Obviously, ideally speaking, you would like to expose the patient first, and then you need to see the contours are to the mark. There are no bony projections or swellings on the shoulders. All right. So you're bilaterally assessing the shoulders, inspecting it from the front, then inspecting it on the sideways. Okay. Then you come here and then inspect it from the sideways. That there is no dislocation, there are no bulgings, there are no rashes present. So you make sure that there is nothing superficial which is causing the shoulder pain. Number one. Number two, you start off with the palpation. You did inspection, then you move on to the palpation. Palpation is you will do all the joint pains. This is acromioclavicular joint, all right, which is a bit of hunched up. So you make sure that there are no tenderness here. Then you go here and you go in bicipital groove, okay, and then you wanted to know any palpate for any capsular tenderness, okay. So you palpate it for the joint line, acromioclavicular joint, bicipital groove, and the capsule. While you're going on to the acromioclavicular joint, there is a bursa, and within that you would like to know subacromial bursa is present in subacromial bursa. You would like to know that is there any tenderness here, okay. Acromioclavicular joint and then subacromial bursa. So by eliciting these palpation, you actually pointing out where is the origination of the shoulder pain is going on. If you find any tenderness here, then you have specified that this is the problem in the shoulder joint. That's one thing. Yes. Yes. And you do it on the other side. The same. Okay. So you will palpate it here, the joint line, acromioclavicular joint, then subacromial bursa, and then there is capsular tenderness present or not, and then bicipital groove. These are the main tender points that are there. Once you do it. Obviously, start off with the normal joint and then you go on to the other joint. Once you're done with your palpation, you did with inspection, you're done with inspection, you're done with palpating the joints. All right. Now you would like to know active and passive movements, and keep this in mind that we are in an outpatient department where you are seeing a lot of patients. Okay. Now here, can you please stand up? Here, what we will do is we will ask the patient. I will demonstrate and ask him to follow me. All right. So I will ask the patient. Can you do it like this? All right. Or can you do it like this? Like this. All right. Yes. Okay. Relax. Okay. When I am asking the patient to do it like this is the combination of 3 movements. Extension on the shoulder joint. Extension, external rotation, and abduction. While I am doing this, flexion, internal rotation, adduction. Okay, so 6 movements there, or 3 movements here, and 3 movements here, and then you're done. Okay, if there is any problem, you rectify that. Okay, the patient is not able to do it like this, or the patient is not able to do it like that because of the pain. So you probably would like to pick that up and pick it from there. When the patient has done this, can you do it like this? Okay, and ask the patient. All right, can push your hand to, can you push your hand with this, to my hand, push it like that, no, push it like that, push, leave that and then push, yeah, push, okay. So this is how you are assessing subscapularis, okay. Thank you.
For both hands?
For both hands, for both the hands, you make sure that there is no subscapularis problem going on. So the examination should be in a flow where you don't back and forth movements while you're doing it. You do ask the patient to do this while the patient has its hand back. You would like to ask the patient to please press my hand with your hand so that you make sure that there is no subscapularis problems. Number one. Number two is, can you do it like this? Alright. So ask the patient to please hold it in this position and I will press it down. Okay. So this is, thank you. So this is an empty can test where you're going to where you're assessing bicep problems, or is there any problem with the muscles inside? Okay, with the flexors actually. Alright. Ask the patient to do it like that. Okay, and then please hold it in this position and then you press it like this. Thank you. Alright, now you ask the patient to, can you elevate your hand like this, hand like this, okay, now overhead abduction, and then you ask the patient to slowly come down. Okay, probably somewhere in time, if the patient is able to do it slowly like this, that's okay. But usually what happens is the patient is here and then he suddenly drops. So this is the drop arm test. And you probably would like to know exactly which level the patient is having problem. One is the 90, up to 90. If there are abducting the shoulder joint, there are muscles specific for up to 90 degree. Overhead abduction, there are certain other muscles that are responsible for overhead abduction. So you make sure that what is exactly where is the problem. And while the patient is coming down from up slowly and gradually, and then suddenly he has a drop, then this is a drop arm test positive. So this is how you make sure that there is a problem. And then there is if you're suspecting frozen shoulder has, what is the presentation for the frozen shoulder? Frozen shoulder has global restriction of the movement everywhere. Ask the patient to do this, he can't do it. Ask the patient to do that, he can't do it. But the characteristic and the basic focus or the main restriction is the external rotation. So you ask the patient, do it like this, and then when you're doing it, it will have this external rotation is a problem. Okay. If you want to do in frozen shoulder, external rotation is something which is very painful. Other than that, the patient has pain, but it is not very significant. But when you ask the patient to do external rotation, it will be very painful. Number one. I have explained the screening test for the active and passive movements. You can also do it individually. Flexion, extension, okay, external rotation, internal rotation, okay. In this flexion, you are also doing adduction. In this extension, you are doing abduction also, or there is an abduction also. All right. So and then you make sure that you are dealing with shoulder pains here also, not dealing with the neck pain. So you also demonstrate the same neck movements. Can you do? Can you see sideways, right, left, okay, down, up. Okay, thank you. Great. So you ruled out neck problems. You started off with the shoulder pain, shoulder approach to a shoulder joint, where you inspect the patient, do palpation, do some screening tests for the movements, do some specific tests, empty cans, abductions, subscapularis, drop arm test. These are some of the. There is another sign called like this, or you need to press it. So I'm actually pulling it backwards and pushing from the front. This is apprehension test, positive apprehension test. So that's another way of actually ruling out some of the occult bursitis problem and dislocation problems which are not very much evident in your history. So that's the approach to a patient who has shoulder problems. Okay, thank you, Shani.